백전백승도동강 새 시대를 열었다. 천리만리의 희상을 온 세상에 떨치자.
Hi, welcome back to Tale of the Peopleists. Welcome back to MTGs and Refugees. Today, I want to talk about a topic that's not just human rights, but a lot about human security. I mean, it's not a whose fault kind of question, who's bad. It's more of a what's the issue question. And the issue is North Koreans' health. How healthy are they? What's going wrong? What should be done to fix it? I know this is going to shock you, but North Koreans are not really healthy. But that's not the question. The better question is, why aren't they healthy? And we have to talk about some systems, some social problems, all kinds of things. But especially we need to talk about what these health problems actually are. We need to know what that means, who is sick, what way, what can we do about it? So before we start, today we have an MTG deck that I've been working on. Consider this a preview. Next Combo Breaker on Friday will go into a lot more detail, but the short of it is that it uses a lot of different mana dorks, Bloom Tender, Great Divide Guide, Enduring Vitality, and the Leyline of the Guild Plaque, or Tam Mindful First Year, in order to unlock rainbow colors, rainbow land, rainbow permanents, all 5 colors. And with the new Strixhaven converge mechanic, this will give you a ton of value. So the archaics here, we have Rancorous Archaic, we have Transcendent Archaic, we have the Sundering Archaic. All 3 of these guys, they get much bigger and do more things if you have more colors on hand. And then we have the Wild Growth Archaic, which also gets better when you have more colors, and it stacks with other archaics to give them more and more counters. Then we also have Together as One. Together as One has been trending recently. It's kind of like Jeskai Revelations, in that it does a bunch of stuff for a high cost, but high cost is not a problem when we're running all these different kinds of mana dorks and things with mana ramps. Once we get the rainbow, this card does 5 damage, it gains 5 life, and best of all, it draws 5 cards. It can be used as removal or direct damage to the face. So also, one of our cards is the Emeritus of Abundance, which comes prepared with the Regrowth Sorcery, so it can fetch it Together as One back from the graveyard and let us repeat the process. All in all, it's a pretty powerful deck that ramps up into big creatures and big damage spells just relying on a single color, and unlike other green decks, it has varied removal, so let's get into it. So as I was saying, North Koreans don't have great health. The Kims probably do, I don't know, maybe they kidnap German doctors or something. I remember seeing some years ago Kim Jong-un suddenly appeared like ultra skinny, and then after some time he bounced back to his usual fat weight. So there's that. I guess even god emperors get sick sometimes, but the average North Korean, especially out in the sticks, are not doing that great. They don't have to worry about getting too fat or something like that. We don't see a lot of tall North Koreans. That's a signal. They don't eat enough. I'm not a nutrition expert, so I'm not going to tell you it's because they don't have enough milk or enough hamburgers or whatever, but I can tell you that if you want to grow big, you should eat a lot of food, and you should eat a lot of different foods, right? School lunches in South Korea, they're wild. They have a different meal every single day of the month, and they come with like minimum 2 proteins, like, I don't know, eggs, fish, beef, chicken, pork, and 3 or 4 different vegetable dishes, every color of the rainbow. So South Koreans are some of the biggest people in Greater East Asia, both tall and wide, but North Koreans are all shorter than South Koreans on average, even when they do live in South Korea. So you can guess that has a lot to do with what they eat growing up, which as far as we know is just not enough. They don't have enough food in general. There are all kinds of reports of poor nutrition, and the food they eat is limited by what area they live in. I mean, if you live on the coast, you eat more fish. If you live in a potato area, you eat more potatoes. No one is eating very much meat, though of course it does exist. And from my experience trying North Korean food, it's kind of bland. And I don't mean that as an insult to their taste or anything like that. I just mean that North Korean cooking uses a much smaller number of ingredients. Like your average South Korean dish, it looks like a rainbow, you know, like chicken dishes can come with onions, green onions, carrots, cabbage, potatoes, sweet potatoes, sesame oil, seeds, chili sauce, soy sauce, garlic, like all these different natural ingredients that carry vitamins, minerals, and different macronutrients, and of course calories. But North Korean food is just much more simple, you know, it's not like minimal like Japanese food or something. It could just be like, I don't know, packed tofu or dried fish with just soy sauce. Like I tried this kind of meat substitute that I think was tofu based in South Korea. And it just tasted like beans and a little bit of sugar and salt, not like the fish cakes here that have 20 ingredients. So yeah, first, malnutrition, What else? Diseases. Organizations like UNICEF and WHO, they went inside North Korea. They still do monitoring, as much as they can. And they release malaria and tuberculosis reports. And both are they're not good. You can check the numbers. You have a high rate of infant mortality. It's like 6 or 7 times as bad as South Korea. I'm not going to go through the whole list of health problems in North Korea, because the short of it is, if it's a health problem for other developing countries, then it's probably a health problem in North Korea too. They just have a little bit of everything. Now, here's the weird thing, right? North Korea is considered one of the absolute least developed countries in the world. Just think of like a lot of these underdeveloped African countries, for example. But if you compare to India or Indonesia, which are mid-developed countries, its medical profile looks way different, actually a little bit better. Usually there are problems with communicable diseases and nutrition in these underdeveloped countries. Communicable meaning like diseases that spread a lot, think of the flu and COVID, contagious stuff, right? The poorest countries in the world have the highest death rates from nutrition and from these diseases. North Korea does not, actually. Even though it has nutrition issues, that's not the cause of its most diseases. In fact, North Korea has better rates compared to Southeast Asia on the average. That means less people are dying from disease and nutrition issues, at least according to the statistics, right? And children are better off too. So in general, you will live longer if you're in North Korea than in a less developed Southeast Asian country. Now that is an average, so keep in mind Cambodia and Laos, they may be driving the numbers down. That doesn't, mean that you should move from Malaysia or Vietnam to North Korea right now. So what is happening, right? Well, okay, I'll get to that in a minute, but first I want to talk about healthcare culture in North Korea, because that'll lead us to the answers. So the one thing that I will say about specific illnesses is when I talk about COVID. So in theory, North Korea should not have seen COVID, right? It's already a closed country. It's hard to get into. And during COVID times, they shut the doors really hard. No one could get in or get out. But I guess they did it, too late. There were already Chinese people going in and out. There were North Koreans coming home from other countries, and then COVID caught and it spread just like in every other country. And what I heard directly from North Koreans is that they dealt with it really badly. I don't mean like bad lockdown policies. There were those too, but I mean in terms of how they handled it medically. At first, they just didn't want to take in any vaccines from overseas. Before that, before the vaccines were even available, the care was not good. So they would get like vitamin shots or something, like placebo shots that just did nothing. And the local medical centers would say, this is the medicine from Pyongyang. The government said this is going to help you. And when people got sick, they felt responsible. They felt ashamed. They kind of hid. Like there was this really negative culture around getting sick. The idea is that it's your job to keep yourself from getting sick. The medical centers are not going to help you. Your village or your town is not going to help you. You're just gonna make problems for other people. It was your fault if you got sick. So really bleak times, right? But actually not that different from other parts of the world if you think about it. There was a huge shame culture around COVID in South Korea. I was living there during COVID. I remember how angry people got at sick people. It was just unbelievable. But North Korea, when they finally got the vaccines, right? Eventually, the vaccines were developed, and eventually North Korea said, okay, we'll take some of those vaccines if you're sending them, WHO, thanks. They didn't say to the people that they came from overseas. People would line up at the clinics and get their shots, and the clinics would say, this is a gift from Kim Jong-un himself. He's saving the people of his country. There's a lot of things to take from that. So what should we take from that, right? It's about the healthcare culture is what I want to say. So I'm from the West, and specifically I am from the US. Countries in the West and a few other, what we call first world countries, right? Highly developed countries and allies of the US. Some countries like South Korea and Japan, they have a liberal approach to healthcare. So what does this mean, right? It means that while public health is a thing in these countries, healthcare is considered a personal responsibility. It is your job to eat right, your job to exercise and visit the doctor regularly on your own. Now, each country has their own idea on, what to do next, right? Beyond just the basics. So some countries have a public culture about supporting personal responsibility. It's very common to have checkups in schools, for instance, in a lot of countries, to make sure that all kids are getting their health care and, to see what they need and all. Many jobs require regular checkups, right? In some countries, your job or your school or your local government is going to pay for your basic health care. Sometimes you are automatically scheduled for doctor's visits. Sometimes you have to schedule your own visit so that you can stay in school or work or, whatever, otherwise participate in society. Sometimes your visit is free. Sometimes you have to pay for your visit. Sometimes even though your visit is free, you're not forced to go at any time. You have to go get it by yourself, right? South Korea it's a mix of that. We have all kinds of free shots, free checkups for certain groups, especially like older people and workers in certain industries, stuff like that, right? But you have to pay attention to find out who can get what service for free, when and where you can get it. It's for me personally, it's a little hard to keep up with it, but I know that there are some public services to keep people informed, especially if you're a fluent Korean speaker. In the US, my experience was that there were very few checkups. Even as a child, we just kind of handled health as a family responsibility. I think I had to get a checkup when I was joining a soccer team, and otherwise I don't remember getting a full physical exam. I got free care when I had a surgery done, but that was something that my family had to go out of their way to apply for. It wasn't just automatically applied to us or something like that. So in short, what I'm trying to say here, a lot of the world uses a kind of hybrid system of public service and funding, public and private responsibility. Sometimes it's up to you to take care of your health. Sometimes the local services are going to make sure your health gets taken care of. But this is a little bit different from the communist ideal. And the communist ideal is that basically everyone can get healthcare, free healthcare, whenever they need it, whatever medical service they need, and public health is like a shared responsibility. So everyone knows when and where they can go to get basic healthcare like checkups or treatments for diseases. So how close is North Korea to that ideal? Not very close, right? Basically, the North Korean system was based off the Soviet system. The Soviet system was designed with this communist ideal. They knew that they weren't going to have, free brain surgery and cancer treatments for everyone all the time as soon as they started. That wasn't their short-term goal, but they were trying to eventually work towards that. If you want to build a city, you don't start with a city. You start by leveling the land and building one house. That's simple enough. So the Soviet system, they started with giving everyone checkups, vaccines, stuff like that, right? They started from step one. North Korea worked this way, to its credit. That was the plan under Kim Il-sung. When it started, everyone could just get medical care whenever, wherever. I don't know the exact limits. I don't know if you had a specific number of checkups you could get each year or how long you had to wait for disease treatment, stuff like that. I couldn't tell you the exact numbers on that. I imagine it was nowhere near infinite access. I cannot imagine some kind of, medical buffet, right? But in theory, you went to a local hospital, they checked your ID, you got your stuff done, you left without having to pay. Basic enough. But this stopped in the 1990s. Everything stopped in the 1990s, if I wasn't clear about this before. When the food aid stopped, so did the hospitals. After the collapse, things got pretty awful. We talk a lot about the bribe economy. If you want to see a doctor, you bring some extra cash, you bring a bottle of soju, cigarettes. It's kind of like what you do when you're trying to escape, what I was saying before. If you don't have a bribe, you could be waiting for months or weeks to see the doctor. The better your bribe, the sooner the doctor is going to see you. Economic magic, right? This is supposed to be communism, and yet it turned to hyper-capitalism, where everything, including life, is just tied directly to how much money you can pay. I don't know. Are things getting better right now? I think the 1990s really changed the direction of health in North Korea. I mean, when it became such a visible country, when people were all like full of pity for the North Koreans. Oh, look at how much they're starving. Look at how bad it is. That was a good chance for medical intervention. I mean, North Korea, it's like the Africa of Asia, save the children, right? It's a country that everyone has wanted to help, especially healthcare NGOs, right? And the leaders of North Korea, they're pretty technocratic. They're not all crazy dictators who want to see people suffer. I don't know why people imagine it like that. They're pretty smart, and they do want to see things run pretty well. They learn a lot from China, which has a very technical support system for public health. So I think North Korea, the government, does actually care. I don't think they want to see people suffer. That's not, again, they are human rights violators, but the reason they violate human rights is not because they want to see human rights violated. It's something that happens as a result of their other policies. So I think the North Korean government cares, and I think they're open to receiving medical aid if it's free. That's kind of an ongoing pattern we see. If you offer something for free to the North Korean government, if it's free, they're going to take it. And because stuff like TB and malaria is, it's so high profile in the international medical community, North Korea got a lot of support from a lot of organizations. They accepted that support. And so those problems are getting better. If you look at the numbers, I put it in the linked article, you can read it and see. If you look at the numbers, things are getting better in those areas, but they're not gone. And then if you look at other diseases, they're just not treated as much. Now, there are still some problems. Of course, there are still many diseases. A lot of things collapsed in the 1990s. They got aid, but it's not like it's all the aid that they possibly need, right? So how about right now? The 1990s are way gone. Is it getting better now? Or are only rich people benefiting from it, or what? Is everything just bribe-based right now? How do things look like right now in 2026, right? What does the public healthcare system do? So here's what we found in a report. Things are changing, right? Things are changing fast. North Korea might be going towards the American model. That's right. No single payer system anymore. You have to sign up for insurance and pay a deductible. Now, as a human rights advocate and as an American, it's extremely hard for me to praise this American-style system. I would be dead right now if there wasn't a special provision for children of low-income families to get free surgery. I don't have good things to say about the private insurance system. Now, with that being said, it's not all bad. I mean, first of all, the American system isn't bad simply because it uses a private insurance model. The problem is that the insurance system is so complicated that you get turned away from hospitals because you have the wrong provider, or your provider just refuses to actually pay the care that's supposed to be covered by the insurance. That's not a problem with insurance itself categorically. That's an example of the insanity and depravity of companies in the US. It's a very unusual situation that we don't see in most countries with the insurance system. It's kind of a cultural thing. So can North Korea work with this kind of private healthcare system then? I don't know. I mean, maybe. If we're being honest, it already kind of was that way. If you think about it, you had to pay doctors directly to get them to cover you. The national insurance system was less of like a here's what we're going to pay for kind of thing, and more like just a suggestion, a lottery. Like if you get lucky, maybe you can get the healthcare. And really, people they're kind of going to hospitals without insurance, practically speaking. They're paying out of pocket to get the doctor to see them. What I'm saying is, if you have to pay a bribe to actually get healthcare, that's just not an insurance system, is it? That is the absence of insurance. That is being uninsured and just handling everything in cash. So maybe formalizing the system is good. If the insurance system is put together right, it can actually get people their healthcare instead of just leaving them to pay bribes. There's a real logic behind the system too, to be clear. North Korea is developing fast. I mentioned this many times. They're building new houses, farms, schools, all kinds of really important pieces of society. They have a really big expense sheet, and they don't have unlimited money, so something has to go. If you charge all the healthcare to the government's bank account, at some point there isn't going to be enough cash flowing out. North Korea is not a debt society. They don't print money like, Jay Powell and the Fed, right? So when they run out of medical budget, that's it. I mean, there's just no way to back that up. So this is kind of like a second tax. And if you're wondering how they collect that, I mean, they're mostly collecting it from the people getting paid to work in factories and stuff like that in China and Russia. So, South Korea. Okay, so up until now, I've been talking a lot about North Koreans in North Korea. And we learn about their medical problems from some on-the-ground workers in North Korea. But we get a lot more clear information when we look at North Koreans in South Korea. You know, the escapees. There's a lot to learn from them because South Korea collects a lot of medical data and it has a lot of public medical research. But also, to be real, North Koreans use South Korean hospitals a lot. And let me explain that. So before I mention the refuge and integration process, but I'm going to touch on that just a little bit. So fast forward, North Korean escapes across the river and goes to China. He or she goes to another country, gets on a plane, successfully escapes, lands in Incheon and gets on a bus to Seoul with some national security guards around to go straight to a security clearance center. So the first step here is medical clearance. You're taking in someone who might have just been crawling through swamps in Vietnam and Laos. They've been living off-grid with no resident ID in China, which means no access to China's public hospitals. One look at their mouth, you can see their dental care is not great. So first things first, you gotta give this person a checkup. North Koreans spend at least 3 months in various stages of reintegration before they can freely move around South Korean society. The whole time they are being watched. So there's a lot of attention being paid to them and to their health. Ironically, they're getting a lot more state care in the so-called liberal capitalist society of South Korea than they would have gotten in the so-called socialist workers' paradise of North Korea. None of these countries really know their own economic identity, I guess, but that's another conversation. The point is that they're being watched a lot. They're getting a lot of healthcare, and they're being taught how to use the healthcare system in South Korea. They're being taught that they should use it. All these checkups and things like that, they normalize the idea of going to the doctors. Hey, look, it's fine. You know, this is something you should be doing. Go to your clinic every Tuesday. Go see a psych if you feel like it. It's all good. It's stuff we just do in South Korea, so just do it. Okay, right. Psych care, right? So that's a big thing. Let me be clear on that. They have every kind of care worker at the Hanwon, the integration center. North Koreans spend a lot of time talking to counselors and social workers, psychologists, psychiatrists, getting all kinds of treatment for their mental health. This is a really big thing, right? A lot of healthcare for escapees. It's not for physical health. They have physical health problems, yeah, of course. But mental health, that's a huge thing. They get a lot of checkups in the Hana Center because there's a lot of checks for trauma. I mean, of course they have trauma, right? Basically, they all do when they arrive because they're coming in with a lot of human rights violations in their past. A lot of them have been beaten in one place or another. They have shocks from dealing with starvation. The research shows that the biggest thing they've gone through is being surveilled in these self-criticism sessions. So what are those? From childhood on, North Koreans have to attend these group talks where they spend the afternoon in a circle admitting what they did wrong and talking about how they're going to fix it. They have to do this regularly. It's a huge thing. And I think it really strips away North Koreans' mental defenses. They feel mentally naked, like everyone is staring inside them all the time because whatever they do, that's wrong or shameful or something like that. They have to admit it. And if they don't admit it, eventually someone is going to find out. That's really traumatic. It creates personality disorders. It's not hard for me to believe it either that North Korean escapees' main issue is psychological health, because when I talk to North Koreans in person, it comes out a lot. They're very open, actually, which could be a result of these self-criticism sessions. They tell me very easily how things are just all going wrong. It's not like depressive talk. It's not mopey stuff. It's more like this kind of bare, honest admission that the world is falling apart and they're just witnessing it. It's not good. And yet at the same time, they're always like hiding something despite being open like this. My theory on this is North Koreans have to tattle on themselves, but they know that they can't admit certain things without going to jail. So they find things to admit. They make them up if they have to. Something that is shameful but not like deadly illegal. and then they hide things that feel to them just too shameful to admit. So at the same time, they're exposing themselves to the world, but they're also hiding things that could get them killed. They're kind of living a double life, right? That's stressful. It's very stressful. They go to the therapist a lot. They have to. But here's the thing. So mental health is a big problem. It's huge. And so is physical health, obviously. Malnutrition, disease, stuff like that. Injuries from abuse, lots of untreated problems. So how much are South Koreans talking about these physical health problems? Is it like a 50-50 split? No. If you check the research, it's more like 10% physical, 90% psychological. So that's it's a bad sign. Why does it seem like regular medical is not a pressing issue for researchers? I can't say 100%, but I will give a little bit of insight from some journalism research that we did. There was a presentation a month ago from these medical researchers. They made an app called MetaBridge, and I'm not promoting this because it's not some kind of app that you can download even if you look for it. It's a special use app. The app is built for North Koreans after the researchers talked with North Koreans to try to figure out what's what. They found that North Koreans cannot easily go to the doctor because they didn't grow up with biology classes and school checkups like South Koreans have. They might not know a lot of common words like heart disease or cancer. So when you go to the doctor, what do? They don't have some kind of special device that they wave over you that gives you every diagnosis. They ask you, what's wrong? What are we looking at? The first clue for doctors is what the patient says. They need to hear what's going on. Does your chest hurt? Does your stomach hurt? Where does it hurt? How does it hurt? I mean, this is difficult for me too, honestly, because Korean is not my first language. A lot of us living in South Korea have complained that we have trouble getting good health care. And it's not because South Korea is low in the world for healthcare quality. It's because it can be difficult to talk with the doctors and get some clear information going both ways. So what this app MetaBridge does, it's an AI thing. You talk to it before you go to the doctor. You rehearse. You tell it your symptoms and it flags what you're saying. No, we don't call it that in South Korea. That's a North Korean word. You should say this, not that. It's not leviosa, it's leviosa, that kind of thing, right? So it trains language, communication. It gets people used to talking to South Korean doctors. The doctors in South Korea, they work really fast. You're in and out of a clinic here. So they want to get patients in and out quickly because they want to see a lot and get paid a lot, right? There's a business to it. That's another problem for another talk. But the point is that you need to communicate clearly, or you're not going to have a good session. And that can be a real problem for North Koreans. So maybe they'll just decide not to go to the doctor. Like I said, the integration center tries to get them used to visiting doctors and talking about their problems, getting checkups. But the key word here is tries. There's no 100% guarantee that every North Korean will be able to use hospitals fine after they leave the center. So that's my theory, that North Koreans don't feel comfortable with medical centers in South Korea. There's underreporting of illness, and so now researchers think the big problem with North Koreans is mental health, when clearly a lot of them need to go to the doctor more often. Also, one last thing that I want to mention, a problem with South Korea's private-public system, because this is supposedly a liberal capitalist country, no one's healthcare is unlimited. You might think North Koreans get unlimited care once they arrive because there are all these counseling centers and social workers and monthly aid payments, but there is a point where it stops. And I know because I had to translate reports from an NGO that did secondary medical support. They had to finance a North Korean guy who ran out of money after getting injured working in South Korea because he could no longer finance his own medical treatment. But he was too young to apply for elderly aid, so he's kind of like in the gray zone of the country's aid network. That's something that happens, and people don't like to talk about it because this is, our healthcare system is supposed to be so big and have so much coverage and be so affordable. It's supposed to be over budget, not under finance. It's supposed to be including everyone all the time and excellent, but in reality, it's not that simple. All right, so to wrap it up, this is what North Koreans are facing. In North Korea, they've been through a lot. In China and other countries too. They get injured, they don't eat enough. They need health care. They're getting some, but not a lot. The government isn't denying them health care, but there's just not enough health care to go around. It's an unfortunate and complicated situation. It is improving, but it's not improving quickly enough. They don't have enough food, they don't have enough medicine, and they just don't have enough money. Aid is not enough to save the country of North Korea. They need to develop a stronger economy. They need to build education so that they can improve health. As for North Koreans living in South Korea, they're better off, obviously, but they still need a lot of improvements. They're just, I don't know, this isn't really anything too special, right? The South Korean healthcare model in general, it just needs to improve. And I'll leave that to public health experts to analyze and figure out. For the rest of us, just keep it all in mind and, do what we can to support research and keep public health on the agenda, because any one of us can get very sick at any time. So think about what people need and keep on peopling.
옥수가도 빨리